Hi, everyone. Welcome to our webinar this morning. How are you? And also, good evening to Erin. And thank you guys all for being here today. Today's webinar is Achieving 90% Fertility Success Rate with Erin. Erin's Acupuncture and Herbal Protocols. And today's webinar is being recorded and presented by Lotus Institute of Integrative Medicine. Here at eLotus, we have been holding educational seminars and webinars for over 2 decades, and we are proud to be your trusted source for premium CEU content with over 200 speakers, 700 courses, and 3,000 hours of CEUs. Before we begin, let me go over a few housekeeping. I just want to give you guys a heads up. Erin is presenting today's webinar remotely. He is actually in Tel Aviv, Israel. And we are in Los Angeles. So there is a time difference there's obviously a time difference. So right now, I believe it's 7 p.m. his time. So he will be teaching into the very early morning of Sunday. So just a heads up. And because he's in Israel, if anything happens, we'll let you guys know, or you'll experience it, but just be mindful of it. Today's webinar is set to run from 9 a.m. to 6 p.m. Pacific time. Erin will, depending on how Erin feels, he'll let you know when the breaks are and how long the breaks and the lunches are. We'll always keep you guys updated. The lecture notes are available for download, and you can find that PDF on the Blue Course Access page. So in the chat room, some of you have already figured out how to use the chat room. It's really simple. You can go ahead and type in there if you want to chat with your colleagues. If you have a question for Erin, please type that into the Q&A. You'll see a Q&A button on the bottom of your screen. You should be able to see it. And then that's where you can type questions that will go to Erin. And when he has time, he will answer the questions for you. Now for the chat room, before I forget, I mentioned it in chat before I got onto camera. If you guys can please set it to all panelists and attendees, because by default, it's set to all panelists only. And when you're typing, only the panelists can see it. So if there's a question that you are asking and you only set it to all panelists, the other attendees won't be able to see the question, and they'll be kind of missing some information when Erin answers the question. So if we can do me a favor and just set it to all panelists and all attendees right now. All right, so there is a quiz for today's webinar to receive CEUs. The quiz is very easy, and if you don't pass, you can always take it again. I'll send you guys quiz information tomorrow afternoon. An email will be sent to you, and the video replay will be ready on Monday. And again, I will send an email out to you when that is available. Okay, so let's see, what else do we have to go over? I think that is it. So we are going to go ahead and introduce Erin for you guys. And so Erin, he is again from Tel Aviv in Israel, and he taught with us last year, and he taught cosmetology and tongue diagnosis. So if you enjoyed the classes, welcome back. And if you enjoyed today's class and would like to watch more, you're more than welcome to look him up. Erin completed his graduate studies in acupuncture, herbal medicine, and shiatsu in 2004 from Medicine College, located in Tel Aviv, Israel. He specializes in gynecology and Chinese cosmetology and has taught leading colleges in Israel. He currently teaches professional workshops and courses in Israel and Europe in Chinese cosmetology, tongue diagnosis, and Chinese astrology. And you'll get a little taste of the Chinese astrology today, actually, with the Batse and fertility. So without further ado, let's go ahead and welcome Erin. I'm going to stop my share here, Erin, and you can share your PowerPoint from your end.
Great. Thank you, Donna. And thank you for all the participants waking up early in the morning. So as Donna mentioned, for me, it's evening now, but we'll go through this whole seminar. It will be fun. If I fall asleep, no, it won't happen, but just raise hand, jump. Actually, it will be nice even to see you if you can show yourself with the, just open the camera. I know for some of you it's morning and no makeup and bad hair day or whatever, but it's okay. We don't judge anyone. We're all at home. So I would like to see you if you want to show yourself. It will be easier for me actually to communicate with you if I see some faces. It's much nicer. But maybe later on also, but don't feel too bad if you don't do that. So I'll just gonna share my screen and I'm gonna start. So I see many participants, which is very, very nice. I'm very glad to see you all. If you can just raise hand or just write down, some of you have written, where are you from? Just, I don't know, maybe I'll, maybe someone from Israel here or just, I don't know, or wherever you are from. So it will be nice to see. Oh, it's going too fast. Okay, California. Okay, how is COVID these days in all the places? New York City, okay, Santa Barbara, okay, Oregon, Long Beach. So most of you I see, Cali in Colombia, I guess. So hola, also, LA, okay, wow. Santa Cruz, a beautiful place. Okay, Puerto Rico. Well, hello and hola, and nice to see you all. I'm very, very excited. I'm like all the last I think few weeks I was very excited and like feeling that I want to give so much in this seminar. So I hope I won't get too confused with all the things that I want to say and to add. But the main thing for me here is to give you much as possible value in this seminar. I've been practicing Chinese medicine since 2004, and we all get our own issues while in practice or in life, and the personal things that gets us to study or to practice several issues, or to focus in one specific topic or even few. It all comes from the need to understand and to help ourselves and to help others. So the issue of fertility is very close to me. I would say even in a very personal aspect, and many people that I see around me, family and friends. Here in Israel, we have this tendency or this need to have many kids. I don't know why is that. Maybe it's part of the roots that we have, but we need to keep on doing babies. And as I mentioned on the preview on Wednesday, we have very good health services here that gives us the opportunity or the ability to do as much as many fertility treatments if there's need in, and they are not limited in a certain way like other places have limitations for IVF, for example. Therefore, the infertility issue, I see that a lot in the practice and, as I said, around me. And I think that with Chinese medicine, we have lots of value to give to these patients, these couples, which are struggling many times with many issues. First of all, statistically, something like 35 to 40% of the problems, I would say, arise from men in this age or this time when cell phones and Wi-Fi everywhere and antennas, and like something happens to the sperm basically of men. And women also have their own issues, and because they're the ones who need to carry the baby, the whole process is happening there, which is a magical process to bring life. So therefore, many of them struggle with many aspects, many physical, many emotional, mostly emotional. And if I can give you just a little hint for what we're going to do from now on, is mostly trying to relax the couples, relax the women. And there are many ways to do that, of course, with Chinese medicine, but many times even just telling the couple or telling the woman, okay, I'm with you, it's okay, you are able to get pregnant and you will get pregnant. I'm with you and we'll do that. And in an amazing way, it happens, and as the title of this lecture, like 90% success with fertility. In my practice, this is the number that I see. Earlier this week, I walked through the many files, for the case studies, and I saw so many years ago, even, 14, 13 years ago, women that, got pregnant. They came even for the second child and even the third, even without going to the Western procedure. And for most of them, I was like quite amazed. I didn't remember it was in such a short quantity of treatment. But for many of them, 3, 5, 6 treatments, and they got pregnant after, sometimes even, 2 or 3 years of trying to get pregnant with all the Western techniques, or I would say, the drugs and all the procedures, and with acupuncture and sometimes with herbs, and just talking and advising and giving tips of how to handle the situation. So many times this is the main thing for them to be relaxed and to be sure about their body, to be confident that they're able to do that, and they get pregnant eventually. So in most of the cases it happens. There are some cases it doesn't happen, unfortunately, but we're not gods. There's no 100% in anything, but that's at least that's what we can do, and it's a lot, in my opinion. Every child that comes to the world, it's a gift. It's a whole world. So it's quite amazing. So this is like my my heart-to-heart introduction to you before we just start to talk about the seminar itself. So what we're going to talk about today. So the main thing is, now I've put the introduction of Chinese gynecology at the beginning, but I'll do that a bit later. Female and male anatomy and physiology. We want to go through the etiologies and diagnosis of gynecology, like gynecological disorders, but to understand the main fertility syndromes, procedures of IVF before, during, and after, Western fertility drugs and procedures, how to build the treatment with acupuncture and herbs, and of course some case studies. So this is like just the basic topics, but as I went through the seminar again and again, I decided to do it in, first of all, to do the Western anatomy, physiology, and all the Western aspects. This is for like the first part of the lecture. And later on to start talking about the Chinese medicine and the effects of that, and how they come in parallel, because women, when they come to the clinic, they usually come after they did some Western procedures or went to the doctor or did some exams. So we want to understand how they work together, or how to work together with the doctors. And sometimes we're actually in touch with them to make the treatment better in both ways. Here in Israel, doctors are very open to Chinese medicine. I remember when I started studying in the year of 2000, there was lots of ignorance, I would say, among Western doctors. And even, the people, common people didn't know much about Chinese medicine. And we've been through 2 decades of insane advance way of working together. At the beginning, it was when I was talking with doctors that said, it's like voodoo. It doesn't, we don't believe in that. later on they said to the patients, okay, you can try, it might help, but it won't harm, won't help, probably. After a while, it became to, okay, I heard there's something worth trying. There are some studies about that. So maybe you can try. And now I think like 50% of the patients I see, even more than 50%, they come after the advice of their Western doctor that advises them to go to Chinese medicine for all kinds of cases. So the majority is, I would say, pain issues and orthopedics, but also many fertility issues, because they just see how it works. They see facts, okay? Chinese medicine works, and there's much more study these days. And doctors and the common people, they just understand that it's something that even worth trying before the Western medicine. So I'm always thinking about how to combine both of them together. Sometimes it is much easier. But you know, if a patient has inflammation, so okay, it's okay to take antibiotics. I don't see something bad with that for a certain time, not the whole time. Of course, we can help with Chinese medicine, but again, it's possible to combine them together. Our goals in this seminar, first of all, to get a bit deeper into the world of fertility. And if you don't practice it, you can see how you can start using some of these ideas or protocols, and even to start a new niche. I believe it's, of course, everything needs a deep study and long study, but you know, sometimes just to start with basics, it is still good enough if you understand the ideas, and you understand, you know, the woman, her cycle, the different drugs, if she takes any, and you know Chinese medicine, so you just need to adjust it to what you do in the treatment, and it might help a lot. Okay, another thing is to learn how to use herbs and acupuncture with these issues of fertility, in, again, very fast and easy way. And the third thing is I think, for me, is one of the most satisfying things in practice, when I see, you know, the two lines on the test, and the pregnancy test. It's something that is really, and again, mostly for women who are struggling for a long time and they want to get pregnant and they can't. It is something which is so satisfying and so fun, and so feeling the heart. So I want you to have this feeling also, and not again to hear, I have pain here and this hurts and aches. Okay, we have enough of that. So just to get some of this new life, to bring new life. So about me, again, Donna mentioned what I did, but just a brief. I will talk a bit about my practice since 2004 with the acupuncture, herbs, and shiatsu. I studied in China at 2008 after the Olympic Games. I went there to search for the doctor, you know, or the old Chinese guy on the mountain, under the tree, telling his stories and secrets. Instead of that, I found many hospitals and many different approaches, and I went to many departments. I started with gynecology and orthopedics, of course, and then I got to cosmetology. So I combined many aspects. It was a big it was a big study for me. I was there for almost 6 months. It's not that much, but I wanted to taste and to experience all kinds of clinics and hospitals. Most of the time I've been to Zhejiang, and it was really a fun time. I've been there with my wife. We studied together, and part of our way to work on our fertility, I would share with you. So we got deeper into the study and to the understanding of that. And since then, I think it was one of the big passions to work with this. So I wrote 2 books that soon will be translated to English. The translation will be ended. One about Chinese cosmetology and one about the tongue diagnosis. And I teach, as Donna mentioned, I teach in Europe now on the COVID time, not really so much. But in Israel and Europe mostly. And in my practice, I see an average something like 120, 30 patients in a week with, of course, a variety of issues and cases in different clinics that I work. Some are my private clinics, but some are like public health care services clinics, which I see many patients there. I don't have too much time with them, but it's an advantage to see these kind of people who won't come to a private treatment because it's much more expensive in comparison. So this is like the healthcare services, they kind of share it, and it's possible to come to these clinics in very low price. And this way, many people can get Chinese medicine in a cheap and easy way. So, of course, part of my practice is about fertility, as I'm going to share with you in this seminar. So, introduction. You know, when a patient comes to us with again the struggle and with the difficulty of getting pregnant, she and her husband, or sometimes they come alone, or if it's a gay couple that wants to get faster and more better way to get pregnant, because of sperm donation is quite expensive. Again, on this aspect, it's a bit more difficult, but they are struggling and they are in lots of pain. Their self confidence and they don't feel that they can trust their bodies, and this creates like evil cycle that every month when period comes, instead of pregnancy, they get more depressed and more anxious and more angry, and it's very difficult to deal with all, even the talks in the family. I don't know how it's where you live, but where I live, after you get married, it's immediately, all the aunts are looking at the wife's belly. Okay, and after 1 month or 2 months, after a few months, they start asking and like getting deeper and digging into your uterus, and it's very frustrating, and it actually blocks the uterus. And when we had it in our private life, it was very, very difficult. And one friend told us, who experienced that, she told us, whenever these aunts, they come to you and tell you, so what's going on? When we're going to see another baby or something? So you just need to tell them, that's what she told us. Just tell them, you know what? When I'll be pregnant, you're the first to know. After that, they just leave you away. So you can give this tip to your patients. I see it works and really reduces lots of stress that women get from this kind of pressure. You see all your friends get pregnant, those who got married after you even, they can get pregnant before you. You see babies everywhere, and you feel like shrinking inside, and like it doesn't help to the process of getting pregnant, let's say that, okay? And so this is one of the issues that we need to work with and to help our patients of getting through this. Now, when we use Chinese medicine, we basically talk about energetic aspects. And in parallel to the Western point of view, when a patient goes to the doctor, to the conventional doctor, and she gets any kind of diagnosis, we need to have our own diagnosis, because most of the cases that I see are unexplained infertility issues. So everything is okay. Like the hormones are good, the blood flow is quite good, you know, the endometrium is good, cycle comes every 28 or 30 days, everything is good, but still she can't get pregnant. And that's where we can get more from our approach, because in Chinese medicine, we can explain everything basically. So we need to find our way to get into this, to this zone and to understand what's going on there on our point of view on the energetic aspects. And of course, it helps a lot. Okay, so let's start first of all with Western anatomy and physiology. You know, the female anatomy is, you know, we have the vagina, the sperm gets in here through the cervix, goes into the uterus, and then just goes all the way, just goes all the way on the fallopian tubes, gets into waits right here. After the ovulation, waiting for the egg to come and jump out. And then the idea is that they need to connect, and should be a fertilization, okay? So it's quite simple. Later on, we're going to see different pathologies that are concerned to these different organs, I will say, in the female anatomy, and also on the male anatomy. Here, the most important part is basically the testicles, okay? They need to create the sperm, good sperm, and all the aspects of, you know, the shape and the movement and the tail that needs to be good, and the amount, of course, the quantity, quality, and everything needs to be working quite good. And if there's a problem in that, we'll see later on the different procedures, how it's possible to use, you know, IUI, for example, or even IVF, whenever we need to get the help with that. Okay, after that, we want to talk about the reproductive hormones. So we have a few important hormones, which are, we need to understand them, first of all. Okay, the first one is the FSH, the follicle stimulating hormone. It regulates the development, the growth, and the maturation of the whole reproductive process in males and females too. It releases by the order of the hypophysis or pituitary gland. So later on, we will see the cycle, exactly how it works, but it's very important that we need, in our treatment, I will always jump a bit to Chinese medicine, but we need to jump, to help the pituitary gland. Later on, I will talk about the extra meridians who are responsible for that. The pituitary gland then stimulates the ovaries, and then the follicles begin to grow. The follicles, they have the eggs inside of them, and with the help of the FSH, they need to grow. So the FSH is also responsible for the development of the follicle in the ovaries, as I mentioned, in the beginning of the cycle, releasing estrogen from the mature follicle and developing the endometrium. This is important later on for the fertilization, because if we don't have enough blood from in the uterus, then won't be any kind of I will say the fetus will not get his space, his place. Okay, so we need that blood. So due to the release of the FSH, the blood vessels also in the cervix and in the uterus, they become wider and there's more blood. In males, the FSH is responsible to the process of sperm production. Basically, there are the Sertoli cells that help in the testicles. They help the creation of the sperm production. The different values that we can see in the tests before women, before they start the whole process, they go through the different tests. So up to 10, the ovaries are good. The reserve is good. Above 10, the quality is quite low, the quality of the eggs, and we need to stimulate or we need to help it with the different ways. Above 20, there's a low chance to get pregnant. I didn't see too many cases which it happened in such values, but again, it all depends on how we can work with that. The other second hormone, the LH, the luteinizing hormone, is responsible for the production of the LH. The production of the LH is regulated by the GnRH, the gonadotrophin releasing hormone, and he's getting the stimulation from the hypothalamus, after that from the hypophysis, the pituitary gland also. So in females, the hormone triggers ovulation and the development of the corpus luteum, like the yellow body. Okay, this is after the ovulation time. It acts synergetically with follicle stimulation hormone, with the FSH. In males, it stimulates the Leydig cells for the production of testosterone. And in both male and females, LH works upon endocrine cells in the sex gland to produce androgens. Okay, the values normally low during the childhood, and with women, it's high after menopause. During the reproductive years, its typical levels between 5 to 20 IU. This is like the international units. And LH levels rise 3 times more during the middle of the cycle, typically. For like 48 hours, the level is very high. Okay, the next hormone is the estradiol, the E2. So this is the estrogen steroid hormone, which is the most important hormone from the group of estrogens. Is responsible for the development of female secondary sexual characteristics such as breasts, fat distribution, how the fat is spreading in the body. It's important in the development and the maintenance of female reproductive tissues, supporting the lining of the vagina, cervical glands, endometrium, fallopian tubes, and it's necessary to maintain oocytes or eggs in the ovaries. During the menstrual cycle, estradiol produced by the growing follicle triggers via a positive feedback system from the hypothalamus or pituitary glands, and which eventually, including the inducing the ovulation. Okay, sorry for I need my AC here because I'm becoming a bit hot this time. Sorry, in the luteal phase, estradiol is also responsible with the progesterone, and they prepare the endometrium for the implantation. Okay, the values during the first week of menstrual cycle, between 20 to 80 pg per milliliter, and at the time pre-ovulation, a period of 24 to 48 hours, between 130 to 200. Sometimes it can get even to the max of 750 pg per mil. Okay, progesterone is secreted mainly from the corpus luteum after ovulation, from the adrenal gland, placenta, and from the testicles in men, responsible for the thickening of the lining of the uterus before pregnancy and the last 2 weeks of menstruation. With the generation of the corpus luteum, the new tissue in the uterine lining are secreted and menstruation begins with a new cycle. Okay, and the values period ovulation less than 2 ng per milliliter, after ovulation greater than 5. Okay, this is just, I'm sorry for reading this. It's just going through that. It's not one of the things that I deal on the daily time, but I believe it's needed to be mentioned. Okay, but we want to see the whole cycle, how it works, basically. If we consider the whole, sorry, just 1 second. I have something here. Okay, so the period begins in the period stage. The period stage, usually 1 to 7 days. Mostly it will be like 5 days of bleeding. After that, we have the follicular stage. They just, in order to make order in that in 4 quarters. So between the days 7 and 14, in case the period is balanced. So after that, and in average at the day 14, we have the ovulation time, then the ovulation stage and luteal stage. Luteal, sorry, there's E missing here. If we go through the whole cycle, and we see that in a whole way. So we can see that the hypothalamus gives the order and stimulates basically the pineal gland. The pineal gland secretes the GnRH that affects the pituitary gland that releases the FSH. Here, basically, the follicles, they get pushed in a way that now they started their growth, and they affect the ovaries. The ovaries, they release the estradiol, the estrogen, until basically FSH, when estradiol rises up, FSH drops and follicle grows in the ovary, again releases the estradiol, the estrogen thickening the endometrium at this part, and hypothalamus again gives the order to secrete GnRH. The pituitary gland again releases now LH. Okay, the pituitary gland gets the order, or like because the FSH drops and there's a feedback to the pituitary gland, now it releases the LH and ovulation arrives. At this time, basically, LH increasing the fat cells, that's what makes the corpus luteum grows, the yellow body, basically. With all that, there's a release of estrogen and progesterone during this time and the next 2 weeks from the ovulation, basically. The corpus luteum continues to grow, and if there's pregnancy, if the egg met the sperm and they manage to work together, then will be pregnancy. And then the placenta releases the SCG, and there's pregnancy, and it will continue for that in like 6 more weeks. If there's no pregnancy, LH drops, and again, cycle begins for another month. Okay, I will make a little pause here to see if there are any questions. Sorry. You can, because I can't see you, I'm sorry. I'm like, I feel I'm talking to myself. If you want to say something, I know it was a difficult time so far, but I just want to know if you hear me, if you are with me, if is everything clear so far. I know it's not a Western medicine, Western anatomy class, but just to give the basics that we all later on can talk about Chinese medicine. Okay? Okay, you're with me? Okay, very good. Okay, excellent. So, okay. Okay, very good. So I'll continue. Thanks. I'll just move my picture. But again, if you want to open your camera and to show me yourself, I will be happy to. I won't feel alone. Okay, I might repeat that many times during this session, but don't be afraid. Okay, I want to see you. Okay, great, thanks. So before a woman gets or prepares to get pregnant, she's going to do some kind of test. So she's doing the hormonal profile. Sometimes they will do that if they need to go to the Western doctor, they will ask that. Okay, so the hormonal profile with FSH, LH, estradiol, TSH, and progesterone. We just need to see, the doctor will want to see it's all good and balanced. We can use that information also. Other blood tests like blood cells and rubella, HIV, all different kinds of tests. I won't talk about them right now, but you know, it's all online, we can check. All kinds of genetic tests. If there's a need, it's possible to do that and to understand. This will help us to understand if there's a problem, like physical problem or hormonal problem or any issue that we need sometimes to treat with drugs or with herbs or without to add our treatment into that. But again, as I mentioned earlier, most of the problems will not show any problem. So it will be just how it's called, blackout. We just problem of getting pregnant without. I don't have. Later on, sorry, I'm sorry. I'm too excited, so words go out of my head. So anyway, sometimes undiagnosed, yes, undiagnosed problems. Thank you. So PAP also to check the whole system, the whole tubes, and sometimes with the retro. It's a long word. With these procedures of like taking the I will say the photo of the internal system. Sometimes because of that, there will be something will open and will open the blockage. Many times on the fallopian tubes, there's a blockage, and when they do the HSG, it sometimes just opens all the blockage there. But again, we can use many herbs to do that also. So let's go next to the pathology of female infertility. So we have different factors that we can see according to the anatomy. Okay, the first will be, and the most common I think, the ovarian factor. So imbalanced hormones such as low FSH, low LH, low ovarian reserve, polycystic ovaries, insufficiency of the corpus luteum, all these can present specific problem. Later on, we're going to see how we can work with Chinese medicine to help that. Sometimes there are inflammations, okay, infections of the uterus, of the tubes, okay, the fallopian tubes, the ovaries, okay, or sometimes, you know, all kinds of procedures such as intrauterine devices that doesn't sit well inside and make some kind of inflammation. So we need to check that. Sometimes antibiotics will help, or any herbs that we see later on the category of that. So and the fallopian tube factors, mostly it's the blockage of the tubes, blockage, and sometimes might be even a worse condition that the tubes are actually covering the follicle, the ovary, and blocks the whole release of the eggs from the follicle. So it's possible to see that through different, X-ray or whatever. And there are also some uterine factors, such as thin endometrium. When it's less than 5 millimeters, it's not enough for getting the fetus, okay, and helping it to grow, okay. We will see different drugs that women are getting in order to do that, but we have our own things to do. And again, infections can be also on cervical factors. For male infertility, we have mostly testicular factors like infections or varicocele or blockage of the ejaculatory ducts. And many times, it's not so many times, but if it's not possible to take the best, you know, on the UTI, sometimes when they're in the lab, when they take the sperm and they isolate the best swimmers, I will say, if sometimes if there's not enough sperm even in the quality or quantity, they will take it directly from the testicles. Okay, in cases of varicocele, when it's all the tubes there are totally messed. There are some problems on the sperms themselves with the motility, the morphology, the count, the volume, all these aspects we see when we send the couple to do the test, or if they come with tests. So we want to see what happens there. Men, most of the time, will not come to the treatment in cases, because, again, I treated several, mostly with herbs. They will take herbs, but for most of them, it's very difficult to come for a treatment. There are some who come, but the majority will not come, and so it will be good enough to work with herbs. Later on, I will give some ideas of that, and some sexual issues on functioning. If the man is not able to do sex, so the sperm will not get to the right direction, and it's a pity. Okay, different fertility procedures. So we have the IUI, the uterine insemination. In this process, basically, I will just open it all. You can read it in between. In this process, basically, all what happens is female, she can get hormones or not. Depends how long the couple is trying to get pregnant. Usually, the doctors will say that at the beginning, they want to see how it works naturally. After a few months of trying without success, they will go through this process when they might give hormones to the woman, and with that to try to stimulate more the hormones, if it's FSH or whatever. Okay, according to what is not right. But even if not, sometimes there's a difficulty of the sperm to get deeper through the cervix and get up to the fallopian tubes. Okay, so in this process, basically with this like a catheter, they will, like a long catheter, thin catheter, they will get it inside, like deeply through the cervix, and they will put the sperm in there. Okay, after a few tries, I don't know, 3 or 4 times, if it doesn't happen, they will go on to the next level of, of the IVF. Okay, the IVF is more complicated procedure when basically the idea is, or I'll open it all also. The idea is basically to see what is wrong. Even if there's nothing wrong, usually the doctors will decide to kind of to take control of the whole cycle. So if it's basically, I would say, if there's a problem with the hormones, of course, they will stimulate the hormones. Later on, the next slide, we'll talk about the different hormones. But if there's, if they see a specific problem, they will work with that, and they will try to adjust to the best option that the follicles will create much more, like even the few follicles and few eggs to be mature, and then they will suck it or assist retrieval to the most appropriate time when the eggs are quite big enough. Okay, usually when they will be, and of course during the cycle they will go through the whole size. They will check who is growing, because many times, because of the hormones, the stimulating hormones for the follicles, there will be few. I have a patient who had in one of the procedures of the IVF, they took something like 40 follicles. They were able to grow more than 40 follicles, and from them they chose the best ones, or the big ones who grew gradually, and on the best timing, they took them away. Then in the lab, they make the connection with the sperm, and they want to give them some time to be together, usually after 48 to 72 hours. They want to see if the embryo creates, okay, or is created, and if it's growing enough and dividing to cells. Okay, so at least 2 to 8 cells they need to be dividing to. And later on, they will just, again, with different hormones that women will get, they will put the cells, the embryos back, one or even few, into the uterus, and with the hope that it will grow and the pregnancy will succeed. Now, if there are sometimes because they are taking many eggs, they will have some extras, and they will be able to freeze them and to use them later on, instead of, again, another like a surgery procedure, just to do it like going back, like the IUI, okay, to put them back. And it's possible to see again how doctors will decide how to use the different examinations and the monitoring, and we basically go follow their way of way of procedure. Okay, usually if a woman starts the IVF, we want to help during that procedure to reduce all the different side effects, or to help with the stimulation, or to relax the mind or the shen. So that we have a lot to do even during that aspect. Now, usually I would do a treatment during the different stages of the IVF. It means I will start with preparation, of course, with Chinese medicine preparations, if it's possible, even 2 or 3 months before, to prepare the body to support all the substances, the blood, the qi, the yin, to support the shen, and of course the jing, to give the whole support there. And during the procedures, before they start the hormones, or at the beginning of the cycle, usually on the 3rd day of the cycle, when cycle starts, the doctors will give the different drugs. And with there, I will help to stimulate the follicles. Okay, later on, after the ovulation, basically I don't have much I can do. I just need to wait until they will put the embryos back in the uterus, and I will do a treatment before they put it back and after, in order to relax the body, to relax the uterus. Again, I will talk about this procedure later on. Okay, and yes, it's possible to freeze. So different fertility drugs. Now, with the different drugs, I would say there are different names. I try to put the generic names, but again, in different places in the world, there are different drugs. So if you don't understand or if you don't know it, or you don't find it in the place you live, just Google it, and I believe you'll find the different connections. But the first group of the drugs that are in use is the drugs that they are responsible to stimulate the ovulation. Okay, so icaclomine, for example, this is one major drug that basically works to stimulate the FSH. Okay, it stimulates the ovary, and then follicles create more eggs. Okay, or the increasing the amount of eggs, and basically it's quite safe and effective. It's given as tablets, usually before the whole process starts. Okay, we need to see that when a patient comes to us, we need to understand when she's taking or what she took in order to support the whole process and not come against it. Okay, it means that we don't want to come against the cycle or against the procedure that the doctor is doing. Okay, so this icaclomine, basically it's given to women who don't ovulate or have less ovulations. Not all women ovulate all the time, every month. And it's possible to say instead, in case, of course, it's safe and effective, but side effects that might have this is thinned endometrium, heat waves, and abdominal discomfort. But again, the doctors will give other drugs in order to support it. Okay, so it usually starts on the 3rd until the 5th day. And it's also good for unexplained infertility. Okay, when the doctors don't really understand why it doesn't happen. And okay, and basically when the doctor gives it, the icaclomine is it blocks, I didn't mention it, it blocks the FSH. So the drug is doing that by itself. Okay. After the icaclomine, okay, and another like 80% effectiveness in induction ovulation. Okay. Okay, I'm just, I saw jumping. Okay, sorry. So other drugs like Menopur or Pergonal or Reponex, there are drugs that contain equal amount of FSH and LH. The hormones are extracted from the urine of menopausal women, and they are given as an injection every day at the beginning of the cycle. Okay, so they might come even together. The side effects are, sorry, superovulation, which means that might be many follicles up to the ovulation, free fluid in the abdomen, shortness of breath, and effectiveness of 95% in induction of ovulation. Now, basically, these kind of drugs, they create lights of moist or dampness in a way. So in our treatment, we need to see that and maybe to balance it. The other group of gonal F is quite common. So they contain FSH, and it's synthetic one. Okay, it's not natural. It's not from urine or something. It's also given as injection. Usually, adding to that is Luveris, also synthetic, that contains LH. Okay, which is like Menoban, like the previous one. And side effects, again, superovulation and free fluids in the abdomen, same as the previous one. What else? Pergoveris. Okay, also, I'm sorry, FSH and LH, less LH than FSH. The combination allows for the combined intake of hormones. Okay, so again, doctors, we usually don't deal with that too much. The doctors, they know their procedures. They might change it from time to time if they see there's no effect or nothing happens. So they will change the dosage or even change different drugs. I don't deal with the drugs much. I just want to know from the patient what she's getting, and I check what's the effect of that drug, and I I adjust my treatment to that. Again, to stimulate ovulations, also these. Okay, again, I will keep it. But again, I don't see any reason to talk much about it. You just, again, the idea is here. You have the slideshow. You can check it. But basically, just to understand what it does. Okay, is it working on LH, on FSH? What it does to what? Okay, so this is basically to stimulate the ovulation itself. The Ovitrel, and usually just a few days also as an injection, a few days before. Usually ovulation will arrive 36 hours after. Okay, recommended to have sex on the day of taking this and 2 days after receiving. Basically, I will say this: if a couple are working on their pregnancy or trying to get pregnant, the first thing they need to know is when the ovulation happens. Okay, when they know, if it's, for example, the best way is on the day 14, but if the period is shorter, so it might be day 11 or even day 12, and sometimes couples are missing that if they work only on 1 or 2 days, if they think it's on the 14th day. So I would recommend, first of all, to know or to follow the cycle and to understand when ovulation happens. And according to that, to start even 2-3 days before, working on that with having sex, and even a few days after. So it's like 1 week. Usually, it's possible to say one day to do, 1 day to rest. But I would say, even if it's becoming a bit technical, I would say it's better to do it like every day on those days in order to catch it. Okay, there's a say on, when the diva comes to the stage, the crowd should be there already. So sperm, can survive for like 5 days. The egg has like 24 hours. So we want the sperm to wait there for the egg. But from some reason, if the sperm is not with good quality or it's not there on the right time, whatever, don't wait for the 5 days. Don't take the chance of 5 days. I would recommend to do that even every day. Every day or maximum every other day, okay? So, okay, there's more drugs to prevent spontaneous ovulation. There are 2 groups of that. There's agonist, like decapeptyl. They prevent the spontaneous ovulation because the doctor wants to control it according to the growth of the follicles and according to the whole procedure that he's doing. And this is in use especially for the IVF treatments. So it stimulates the hypothalamus and releases the GnRH hormone that triggers the release of FSH and LH. Okay, the treatment is given in a long protocol in which ovarian stimulation drugs are given only 2 weeks after the start of the, basically again, I'm sorry if I don't want to read it all, okay? I don't want to become, just to read. You just need to follow the directions of the doctor and just to understand the process in that. We will do the rest with the treatment. Later on, I will talk about it in details with our procedure in Chinese, with acupuncture. So decapeptyl and, okay. Through the nose Okay, and drugs, those are the antagonists. Okay, so they immediately suppress the secretion of LH and prevent the self-ovulation very effectively. Okay, so again, different types. With your permission, I will go on to the next ones because it's becoming too long and we have enough to do today. Drugs to support pregnancy. Okay, if the woman got pregnant, then there's a need to support the fetus that is now grounding and gets the whole nourishment from the placenta and from the endometrium. Okay, so these drugs, they contain the hormone that supports that. Okay, in IVF or as part of IVF treatments, it's possible to give these drugs after that. Many times they are given as like in different ways. Basically, through like endometrine is given. The woman needs to put it in the vagina, and it supports and lubricates the whole area. So this is in case the pregnancy is positive. It doesn't affect our treatment. We don't need to do much about it here. Okay, next one. Okay, Chinese gynecology. Okay, maybe we can take like 5 to 10 minutes break with your permission, if it's okay, and because I want to start it, to take it like to go on with that, okay? I don't want to stop later on. So, okay, sounds good. Is it okay? So 10 minutes break. So let's say now it's, I need to switch the time. So, so 10 and 20, like 20 past 10, okay? And we'll come back, all right? Okay, great.